Today I'm going to talk to you about erectile dysfunction. When it happens to a guy, especially the first time, it's scary. It's embarrassing usually because it happens at the worst possible time. But today we're going to talk about what are some of the causes, what are some of the things you can do long term and short term for quick fixes. But we're going to talk about what actually really does work and what's really effective and different, depending on where you are in the stage of erectile dysfunction, what your cause is, some things you can do. First of all, we'll talk about hormone therapy in a little bit, but if you don't wake up every morning with an erection, that's the first sign. Now that could be due to lower testosterone, which we'll talk about, or that could be because you're having blood flow issues. So erectile dysfunction is always a blood flow issue unless it's hormonal. But for most of the time, if your hormones are right, your testosterone levels where it needs to be, and your estrogen levels right, and you're still having erectile dysfunction, it's because of your blood flow. Now, most of the time, when someone first experiences erectile dysfunction, usually it's because they have low testosterone. And we see it all the time. They don't come in here because they have the traditional symptoms of low T, which is fatigue and things like that, memory, brain fog. It's all about the erectile dysfunction. And usually when we get the patients, their testosterone levels where they need to be, the erectile dysfunction goes away. But for those who don't, they do have normal levels of testosterone and they still have erectile dysfunction, it's a blood flow problem. And obviously there's some tools you can use to correct that. But regardless, long term for everybody, whether you currently have it or not, some of the things you need to do is to prevent it or even possibly reverse it is to take care of your cardiovascular system. So anything that will improve that situation is going to improve your erectile dysfunction. And normally when you start to experience erectile dysfunction because of blood flow, it's a sign of you're having cardiovascular disease or there's issues that could come down the road because you're having a blockage. So what can you do long term? We're going to talk about the long term first. First, you've got to clean up your habits. You need to exercise. Obviously, that helps with just blood flowing throughout the body. You need to lose fat. You need to, keep your muscle or gain muscle. You need to eat a lower carbohydrate diet because everybody's a little bit different. This is just a general swath, but sugar or carbohydrates, basically sugar. And if you have high levels of blood sugar or elevated levels of blood sugar, it damages the inner lining of the blood vessels, which then causes a cascade effect where it needs to be healed. It attracts cholesterol, which then turns into plaque, which then turns into blockages. So the lower you can keep your blood sugar long term, the more healthy your blood vessels are going to be. So that's why we talk about a lower carbohydrate diet. Eliminate the refined sugars and go to a lower glycemic, carbohydrate. Stay hydrated. Proper salt intake. You always hear about salt, especially when it comes to high blood pressure, but your body does need salt. You can't have a salt level that's too low. I did that at one point. I was doing a lot of fasting. Cardiovascular disease runs in my family, and I was very careful about that. And I was getting to the point where I was getting dizzy. I was drinking a lot of water, close to a gallon a day. I was fasting, but I wasn't taking any salt. And I wasn't eating out, so I wasn't getting any, and I didn't put anything on my food. And I started having dizzy spells and heart palpitations and stuff like that, and come to find out, I ended up having to go to the emergency room, and what it was, low sodium. So, I went through a whole battery of tests, and the cardiovascular, surgeon came back in and said, listen, you're dehydrated. So there's no way I'm dehydrated because I'm drinking almost a gallon of water a day. He said, and you also have low sodium. He said, if you don't have enough sodium in your body, that water will just flush right out. And that's why you're getting dizzy, and that's why you're having all these other issues, electrolyte issues. So he said, make sure you get your salt. So if you're scared of salt, don't be afraid. Don't overdo it, but make sure you're getting enough. It also helps with neurological issues. So you just need to make sure you're getting your salt. Also need to make sure you have no vitamin deficiencies. Especially when it comes to cardiovascular, potassium magnesium, and D3. And almost every American in the country is deficient in potassium, magnesium, and D3. So you need to check those levels. You can check those. We check those through blood. I had mine checked, and I now take supplements for that. You can take fish oil, CoQ10. Anything that will help your cardiovascular system is what you need to be doing to improve your erectile dysfunction, not only now, but in the future. One vitamin that you can actually, they have the research now that shows that you can reverse the age of your blood vessels is taking a combination of D3 and K2. And you can do your own research on that, but I do take it. And this is not medical advice, this is just for educational purposes only, but I do take it. There's a lot of research behind it, and there's going to be more, where it actually removes the calcium buildup in your blood vessels over time, because K2 basically tells your body what to do with the calcium in your body, and like put it back into the bones, put it into the teeth, and it removes it from your blood vessels and puts it where it needs to be. So do your own research on that, but D3, K2 is also very important, especially if you want to try to reverse those issues. Now, besides a blockage, some of the things you can experience when it comes to blood flow is called venous leak. Now, venous leak is where the valves, as the blood pumps through your blood vessels, the valves don't close, so they can keep that pressure and then pump again. So what happens? It just goes back and forth. Well, the same thing happens with erectile dysfunction, is you can get an erection, but you can't keep it, or it doesn't get fully erect. Well, one thing you can do when you have venous leakage, there's a couple things you can do for it. To permanently fix it, the only thing that will permanently fix it is surgery. And most people want to try to avoid that if possible. The temporary fixes is you can use a restriction ring, which when your blood flows in, you put the restriction ring on, and it keeps the blood flow in there. And you can typically leave it on for about 30 minutes before you have to remove it. And we're going to talk about some other quick fixes like Cialis. Cialis was specifically designed for smooth muscle, which is what the valves are made of, and it will allow your valve to close when otherwise it wouldn't. So if you're having venous leak, you want to avoid surgery, the best way to deal with it is to take Cialis or tadalafil, which is the generic form of Cialis and much cheaper, or use a restriction ring. So long term, take care of your cardiovascular health, make sure you have the right supplementation, and you can possibly improve that or reverse it, or at least keep it from getting worse. And typically, just a little side note, I was listening to several doctors probably about 9 months ago. They were talking about the efficacy of the Viagra and Cialis, and typically it would work for about 5 years. But what they were saying was, it wasn't that the medication wasn't working anymore, or the body adjusted to it. It was that the patient's health was getting worse. So you have got to think about long-term your cardiovascular health, because even though the medication is working now, some of these quick fixes we're going to talk about, doesn't mean it's going to continue to work. Because if your health or cardiovascular system continues to get worse, it will eventually not work. So head it off, prevent it, and try to take care of your cardiovascular system right now. The number one fix we have seen for fixing ED, at least it's been in our experience, and we've been in business as a primary care for over almost 10 years, is being when a patient's coming in with ED, when we got their testosterone levels fixed or at the proper levels, it usually fixed it. Not all the time, but most of the time. That's all they needed, was just get their testosterone levels fixed. We had one patient that had erectile dysfunction for 12 years. And it got to the point where his wife was about to leave, and he decided to come in and do something about it. And when he came in, after his first, now this is not normal. Everyone's different. Typically, you'll need to be on therapy about 3 to 5 weeks to see differences. But after his first shot, he was able to get an erection for the first time in 12 years. Now, he said he wasn't able to keep it, but he was able to actually get an erection. And by his third week or his third shot, he was able to have intercourse with his wife for the first time in 12 years. And all it was his testosterone was low. So If you're starting to experience ED, don't wait. Just go get tested. Find out what your testosterone levels are. And if they're low, get them optimized, and usually that'll fix the situation. Some other things that can work and have some research behind it that we've seen work, especially if they're very mild. If your testosterone levels are good and you're still still experiencing it, some things that you can do is all to help with the blood flow. One supplement that's very inexpensive and cheap we've seen that works is L-citrulline, L-arginine. That's in a lot of supplements that help with blood flow or get that pump. And what it does is relaxes the blood vessels, allows them to just relax, allow more blood flow through. And sometimes that can be a help. If that doesn't work, the next step is to take a medication like Viagra or Sildenafil, Cialis or Tadalafil, which is the generic, or Levitra, something like that. It's going to help with that blood flow. Viagra typically takes about 45 minutes to kick in. It lasts for about 3 or 4 hours. Cialis is something you can take daily or as needed. When you take Cialis, it takes typically about 3 days for it to saturate your blood. You're taking 5 milligrams a day, or you can take a 20 milligram as needed. But once your blood is saturated, it'll last for about 36 hours. So it's more of whenever you want to be ready, it's there. There's some other benefits to it, but Cialis seems to be one of those that you can take and you don't have to take it and time it. So those are the most popular ones by far, and they're very effective and they work as long as you don't have a total blockage. And it's, especially if your testosterone level is low, sometimes it'll help if it's low, but usually you have to have your testosterone levels back where they need to be first, and then you can add this to it if you're still having issues. Now, the next step after, if the oral medication is not working, the next step usually for a lot of patients is if they can get any type of blood flow in there, is they'll use a vacuum erection device, VED, with a restriction ring. And what that is it just pulls the blood into the penis, and you slip off the restriction ring and it holds it in there. And that works great, but obviously you have to use a pump. It takes a couple minutes to get it set up and ready. And the negative thing about it is you can get the erection and it's good enough to have intercourse. But the negative thing about it is from the restriction ring forward, it's erect. It's still it's not like a normal erection either. It's still a little soft and spongy, but at least it's enough for intercourse. But behind it, there's no support. It's like a normal erection. So you have to be kind of careful with it. You have to kind of guide it. But it can work and it is effective, especially when oral medication doesn't work. And some patients will even use a combination of both. The next step after the oral medications or the VED restriction ring is penile injections, which the most common medication people know about is Trimix. And there's several different customizations. You can do quad mix and the super quad, things like that. But that's where you inject the penis directly in the side, usually at the base, and within about 5 minutes you'll have an erection. And ideally you want to keep the erection for about 30-45 minutes, and then it kind of subsides. So those work. It's very effective, especially for someone who has had the pump and the penile injections. You've had prostate surgery and you've had damage to the nerve and you can't get an erection, or you've had a spinal cord injury. The penile injections, it has nothing to do with anything mental. You will get an erection. And that's especially if you've had a spinal cord injury and you still want to be able to have sex with your wife or your significant other. The penile injections will help you get there. The next after that, if none of that works, the next step and the final step is a penile implant. The penile implants, of course, the insurance doesn't cover any of this. The penile implants is usually the last step when nothing else is working, but it costs about $15,000 to $20,000 to have it done. The insurance does not cover it, so it's going to be out of pocket. And what they do is they go in and put the implant into the penis. They remove one of the testicles usually, and will put the bulb there, or they'll put it in the abdomen and you just pump it 3 times and you have a full erection. and it's you'll lose typically about 1/2 inch of length, and you typically don't get the full girth, but you still have the feeling. You can still have an erection for as long as you want. It can be pretty awesome. I've talked to the patients who have had it, and if they get to that point where they have to have it, when they do have it done, they love it, because they can get an erection anytime they want. 2 or 3 pumps, it's up, and they can release the valve and it's down a second, so it's always there. It feels almost the same, and obviously the spouses love it. So that's a last resort when nothing else works, and it's very expensive, but there's always a way to get an erection if you can on your own. Now, there's some things that there's so many medications, I might have to cover these, but there was a lot of medications that I knew would cause erectile dysfunction, but there's a couple that I didn't know about. First, any type of antidepressant or any type of psychiatric medicine will cause ED. We see it all the time. And there's something you could use, oral medications to offset that. But if you're on some of those medications, antidepressants or psychiatric medication, and you have erectile dysfunction, that's maybe a very good reason, the good cause for that. This is what I was surprised about, antihistamine medicines. You know, I'm always dealing with allergies, issues like that. You know, Benadryl. You know, I had no idea that would cause it, but you're taking something like Dramamine, Benadryl, Phenergan, Zantac. Those can cause erectile dysfunction, and those are some of the medications I'm also surprised about. Any high blood pressure medicine or water pills can cause it, and if you're on high blood pressure medicine and you're having erectile dysfunction, that's probably the cause of it. But everybody's different, and there's things you can do to overcome it. But it's most common is in the beta blockers, the beta blockers and the thiazides are what cause it. The alpha blockers don't cause it as much, but the high blood pressure medicines will, or any of the diuretics. Any medication for Parkinson's, any medication for chemotherapy can cause it. Stuff like Flexeril, Atavart, finasteride, H2, blockers like Pepsid, Zantac, those things can cause the erectile dysfunction as well. Obviously, opiates, any type of codeine, fentanyl, things like that can cause it. Obviously, alcohol, if you're taking that, and amphetamines. Now, one medication, for example, like phentermine, which is used a lot for weight loss or to suppress the appetite. We hear that a lot with phentermine, where they just can't get an erection, or they get one and it goes away. They just can't maintain it, and they have no control over it. So if you're on phentermine, and you're having erectile dysfunction, that's probably why, or one of the reasons it could be. Now, there's also a lot of psychiatric reasons that could cause it. It's if you're under a lot of stress, maybe whether it's from work, if any type of anxiety, whether it's very specific or it's very just general, just a stressful time of the year, that could be a good reason for it. And the way to know that is if you wake up in the morning or you get erections throughout the night, or wake up in the morning with an erection, that's probably a pretty good sign that it's not a blood flow issue. It's most likely probably just stress. And you'd be surprised how much stress can affect that. If you're having any type of fear or sexual performance issue, just thinking about it can keep you having an erection. Just calm down, relax, don't focus on it, and just learn to deal with that stress. You could probably eliminate that, especially again if you're having erections throughout the night or wake up in the morning. If you have any type of depression or mood disorders, if you have relationship problems, if you have low self-esteem, all of those are stressors and cause anxiety, and it can cause you to not have an erection or have erectile dysfunction. Also, excessive porn consumption. You just, what is normal doesn't excite you anymore, and which all you need to do is cut that out for a little while, and things will normally return back to normal. So if you're watching a lot of porn, stop it, reduce it, stop it for a little while, and give your body time to adjust, and it will return back to normal usually. So again, psychologically, if it's all because of stress or anxiety, but you're getting erections every morning or having erections at night or just any other time spontaneously, but when you're in the act or about to act and you're having issues, it's just stress. So don't freak out about it, because you don't stress about it, because it'll make it worse. Just learn to handle the stress, and it'll come back. So those are some of the main reasons for erectile dysfunction. And if you're experiencing that, there's a lot of people that can help. And just remember, if you don't, look at testosterone, look at your cardiovascular system. There's a lot of things that we can do to help correct it. Don't freak out about it. There's always a solution. It doesn't matter how bad it is. There's a solution for it. But like I said, the first place to start is, work with testosterone, find out, make sure it's optimal. And then from that point on, there's a lot of different avenues you can take to figure it out. But you can get it figured out, so don't worry about it. So if you have any questions, feel free to give us a call, contact us, comment. I'll be glad to answer what I can. This is not medical advice. You need to seek the advice of a medical professional. This is for educational purposes only. And the results that some experience, some others won't. So everybody's biochemically different. So if you have any questions, just let us know.